السلام عليكم ورحمة الله وبركاته. بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على سيدنا رسول الله وعلى آله وصحبه وله. Welcome everyone to the second session of our series of Excellence in Radiology within Hajj season. Today, inshallah, we will talk about how to mastering the contrast use during the high surge of patients during Hajj season, how to be fast, focused, and fearless. We will start immediately, saving your time. Uh, by the end of this lecture, inshallah, we will be able to recognize the key safety principles for IV contrast media based on ACR and MOH guidelines. Also, we will be able to identify which preparation steps are essential and which can be skipped in urgent Hajj scenarios. We will apply efficient workflow to balance patient safety with MOH mandated 60-minute turnaround time. And we will respond appropriately to allergic-like and physiologic contrast reactions. And finally, how to collaborate effectively with the technologist, radiologist, and remote reporting teams during high-volume situations. In Hajj season, usually we have overcrowded emergency departments. We have diverse staff from multiple regions, from MOH and outside MOH. We have multiple life-threatening conditions requiring CT scan. So we have to be smart and fast dealing with these requests and dealing with different diverse staff from multiple regions and multiple institutions. And we have to be committed with the turnaround time of 60 minutes from order to report, as we discussed yesterday. So our main challenge during Hajj is the 60-minute mission. Okay, this is the usual non-contrast pathway. Usually from order to report, the journey will not take more than 30 to 35 minutes. 5 minutes to arrival to the radiology department, another 5 minutes for positioning, another 5 minutes for scanning, and the report may take 20 or 25 minutes. And this is for non-contrast study. And the main bulk of cases during Hajj are non-contrast CT scans. But regarding the contrast enhanced CT scan, the workflow will be a little bit delayed. Usually it takes from 75 to 90 minutes. So how to reduce this interval or this time from 90 minutes to be committed within the 60 minutes of turnaround time. Okay, so by looking at the pathway from order, there is usually, due to the preparation of the contrast study, most of the radiologists will ask about the creatinine test, pregnancy test, allergy test, and pre-medication for history of allergy, ask for fasting for 2 hours, 4 hours, sometimes 6 hours, and some of the radiologists ask for oral contrast also, or rectal contrast, and consent. All these will take from 30 to 1 hour, 30 minutes to 1 hour usually. After that, to insert the line and to check the IV line, we need another 10 minutes. After that, the scan will get 20 minutes. For example, if we need to repeat the exam or to get more delayed images, we need more time. After that, we need 5 minutes for recovery, and the report will be issued after 15 or 20 minutes. So the overall journey of contrast enhanced study usually lasts for more than 1 hour. So how we can accelerate this process, how we can skip the unnecessary steps, this is what we will talk, inshallah, in the few next slides. And so our main aim now is to accelerate these 4 steps between the order and to the report. Okay, let's start with the first one. First of all, the lecture is based mainly on the ACR manual of contrast media and MOH guidelines for safe use of contrast media. The ACR is updated at 2024. There is another last update in 2025, and the MOH guidelines released at 2021. You can read them, and you will find a lot of changes regarding our old practice. So before going to the complications and the preparations need to avoid complications, I want to show you the difference between the ionic and non-ionic IV contrast media. So previously, the contrast media was ionic. Nowadays, our contrasts are non-ionic. All are non-ionic. Okay, and you can see here in this diagram the prevalence of complications with the ionic contrast media on your left side, and on the right side, the non-ionic contrast media. There is a huge difference in the prevalence of complications, all types of complication between both categories. So nowadays, we are dealing with non-ionic contrast media, so the prevalence of complication are very, very less as compared to the previous category. This is number one. Now, regarding the complications, allergy. If the patient has a prior allergic-like reaction to contrast media, there is a five-fold risk of increased or another episodes of allergic-like reaction if the patient exposed to the same class of IV contrast media. I mean, if the patient is allergic to iodinated contrast of CT scan, he will have five-fold increased risk of another episodes of allergy if he received the same class of IV contrast. But if the patient is allergic to something else unrelated to that type of contrast, there is only 2 to 3 folds of increased risk of another episodes of allergic-like reaction. Okay, some of the patients are allergic to some medications, food, another type of contrast. So by this definition, the ACR said restricting contrast media use or pre-medication solely on the basis of unrelated allergy is not recommended. So please, no need to pre-medicate the patient if the patient is not allergic to the same class of contrast media. This is very important, and it will help you to facilitate the process during Hajj. Renal insufficiency. In case of chronic kidney disease, we have to check the GFR. If the GFR is above 30, we will consider it grade 1, 2, 3A, or 3B. Okay? And in grade 1, 2, and 3A, 3B, you can see here in the table the risk of or prevalence of complications related to contrast-induced acute kidney injury or contrast-associated acute kidney injury is very, very low. So it is safe to start with contrast injection if the GFR is above 30. But at that group here, from 30 to 44, okay, we have to hydrate the patient first. Give him IV hydration, good hydration before and after contrast. Otherwise, if the GFR is above 45, there is no need to delay the scan. Go directly to inject the contrast, and it will be safe, inshallah, regarding the kidney. But be careful. This is not like acute kidney injury. Acute kidney injury is a different scenario. Number two, if the GFR is below 30, double check if the patient is on regular hemodialysis or not, and then you can proceed. So the prevalence of renal insufficiency or risk of contrast associated or induced acute kidney injury is very, very low if the GFR is above 30. And this is also regarding the gadolinium, okay? So we have other scenarios regarding renal insufficiency. If the patient has only single normal kidney or partially functioning kidney, like agenesis, nephrectomy, or previous transplant, all those patients should be managed similarly to patient with normal kidney volume. Check the GFR. If the GFR is normal, proceed. If the GFR is abnormal, stop. Okay? Prepare the patient first. So we have to deal with all these scenarios as normal kidney volume. as two normal kidneys. Okay, so agenesis, nephrectomy, transplant, check the GFR again. Okay, there is no special consideration regarding this group or this scenario. Metformin use. Patients taking metformin are not at higher risk than other patients for post-contrast acute kidney injury. Iodinated contrast is a potential concern for furthering renal damage in patients with acute kidney injury and in patients with severe chronic kidney disease. So, in acute kidney injury or chronic kidney disease, severe chronic kidney disease, grade 4 and 5, okay, we have to stop the metformin. Otherwise, no need to hold the metformin, no need to stop the metformin. You can proceed either before or after. Proceed for IV contrast, and that would be enough. There have been no reports of lactic acidosis following intravenous iodinated contrast media administration in patients properly selected for metformin administration. Closely spaced IV contrast media studies. Sometimes we have recent contrast enhanced examination within a very small elapsed time, within the same day. Okay, the patient already have CT scan today morning. Now they ask us to repeat the scan for any else reasons. Okay, so this is defined as closely spaced IV contrast media. What we have to do with these cases, okay, if it is not medically inappropriate to delay, uh, uh, permitting more than 24 hours, allowing for greater clearance of the contrast media from the blood. And if the case is not urgent, please delay. Give the patient space for 24 hours. But if there is an urgent indication that requires closely spaced administration of standard dose of IV contrast media with normal GFR, okay, the examination should not be delayed. You can do multiple examination as medically indicated. Sometimes we have a case, for example, for polytrauma. We scan the patient from head to pelvis. After 2 or 3 hours, they ask us to repeat the exam to check for CT lower limb angiography, for example. So if there is no risk of delaying, okay, please repeat with same dose, okay? Especially if the GFR is normal above 30. So the administered diagnostic dose of IV contrast per day should be as low as reasonably achievable. Dose reduction is not recommended. When we are repeating the exam, don't reduce the dose of the IV contrast, okay? To keep the quality of the image good as much as we can. The contrast-enhanced MRI may be performed immediately before or after contrast-enhanced CT and vice versa safely, okay? So if the patient has a contrast-enhanced study MRI and he wants to do CT scan at the same day, it's okay. And if the patient did CT scan and he wants to do MRI contrast-enhanced as medically indicated, it is okay and safe. So what are the core principles of IV contrast use? So use contrast only when benefit outweighs risk. Understand allergic-like versus physiologic reactions. You have to know the risk factors if the patient is asthmatic, have chronic kidney disease, or any prior reaction. And you have to know the high-risk population for contrast-induced or contrast-associated acute kidney injury. And those patients kidney surgery, kidney ablation, albuminuria, history of diabetes, and metformin or metformin-containing drug combination. All these what we don't need during Hajj emergency. No fasting is required. No creatinine needed in low-risk patient. no pre-medication unless known severe prior reaction to the same class of contrast media, and we have to be fast as much as we can. Regarding the IV access, do it right the first time, okay? Avoiding repeating cannulation. Use 18 or 20 gauge catheter. 20 is good for angiography, and always insert the catheter within the antecubital fossa, okay? Confirm flow before injection and avoid hand or wrist as much as you can. Prior allergic reaction, what to do? Confirm reaction history. Use accelerated IV premedication if needed instead of the oral premedication, and be ready to manage the breakthrough reaction. The breakthrough reaction is a prevalence of complication despite the premedication. So most of the patient, even premedicated, they will have a mild or moderate allergy-like reaction after receiving the contrast. Rapid workflow protocol. Verify ID and allergy. Use box flags, for example, like stroke alert or overhead calling. Send key clinical information with the request completely before sending the patient to the radiology department. So we have now another big challenge during Hajj is the language barrier. Language barrier is a hidden challenge during Hajj season because we have diverse pilgrims from the globe. Most of them speak non-Arabic or English language like Urdu or Turkish or etc. Okay. Miscommunication may lead to fear or refusal of the contrast injection, delays in workflow, and incomplete or misunderstood instruction. So what we have to do, number one, we have to assign a dedicated medical interpreters if available in your hospital during the scan, and translation support teams can be reached by phone or in person also. You have to ask your administrative medical office and your hospital if there is any contact information or phone number for the translators. And number two, you can empower pilgrims with technology like QR codes. Provide patient with QR codes linking to short instructional videos or handouts in multiple language. And we have created a good example last year in last season. We have our own instructions in different languages, around 30. You can scan this QR code if you want, or you can capture the screen and use it later on. We have here general guidelines for the safe use of intravenous contrast and the frequently asked questions. This is the PDF file. We have 30 different languages. By clicking on the desired language, for example, here, Turkish, it will go immediately to the general instructions and frequently asked questions, and you can discuss all questions of the patient safely and quickly. Okay, by clicking on this arrow here, you will go back to the main page. So language barrier during Hajj is a hidden challenge. Always be ready. And believe me, understanding builds trust. One clear explanation can save minutes and lives. So patient safety is non-negotiable. Confirm ID, indication allergy status, explain risk briefly, and monitor after injection. Okay? Emergency support, who's with you? We have local and remote teamwork to discuss the cases with them. We have the Saudi Saha Virtual Hospital in Riyadh with telemedicine or teleradiology reporting with us. You can call the radiologist to ask them about the protocols, when to give contrast or not. You have the radiology service team in Mecca cluster. You can call us anytime and you can ask us if you have any question. Contrast reaction kit should be ready, okay? Always review your emergency medication and tools and reinforce quick access and team readiness. And this is our final take-home message. Speed saves lives, but safety saves more. Thank you very much. And you have any question? Please raise your hand. Okay, thank you for your time. I'm also waiting for your questions. If you have, please, uh, you have the link for feedback in the chat box. Okay, please do the survey for feedback. Thank you very much again for your time. And inshallah, tomorrow we'll have our last session about post-mortem imaging. Okay, thank you very much. اوكي شكرا ايمن يعطيك العافيه.
شكرا دكتور، بارك الله فيك، جزاك الله
شكرا
خير.
شكرا لكم، في امان الله، مع السلامه.